Welcome, friends. This is Dr. Jaitly from New York, your cardiologist, on your video site on several social platforms, MuniMeterHealth. Thank you for being associated with us. And of course, as I always say, medical education, patient education together, if you combine, you can certainly enhance the clinical outcomes. And that's one of my global initiatives where I'm pushing through my channels on MuniMeterHealth. So thank you again for being associated with MuniMeterHealth here with us. Without any further ado, this is a very short video where I'll be talking to you about the cardiovascular non-modifiable, so-called, again, that's a myth. So there are non-modifiable factors which we consider as, I consider personally as factors which are still modifiable. So let's understand, what are the non-modifiable factors? Age, sex, and then of course the heredity, which is a component here. So you have these three factors which could be considered as non-modifiable, so-called, but they are actually, as you see, I'll just tell you, they are fairly modifiable. So age, we constantly think that in men, for instance, now here's a factor, less than 45, they should not develop coronary artery disease. So the coronary artery disease is almost unknown at the less than 45s. Now in women, it's almost unknown also at the less than 55, for instance. Okay, so here it's a risk which is not heard. But men past the age of 45, that's where they will develop coronary artery disease and start to increase their risk rather rapidly. And women more than 55, as I said. Okay, now throw in the factors like smoking, for instance. Now, age and sex, we are doing it together because obviously we're looking at the gender here together. So smoking, for instance. Now, throw in a smoking in a man or a woman. Wouldn't the coronary artery disease risk factors be accelerated? Obviously. Throw in the food habits, for instance. Now, these are all, you notice, these are modifiable risk factors. Throw in the food habits, like depending upon what the environment the child has grown. Sometimes it's work-related, sometimes it's environment-related. So food habits could be all non-clean, if you will, if I could say. And if you're eating the unhealthy food, junk food, the chances are your coronary artery disease factors will increase, even less than age of 45 in a man, and so also in the less than age of woman 55. Weight gain, obviously, and that's related to the food habits here. High cholesterol, which is also related to the food habits here. And then, of course, tendency for diabetes, for instance. And there are many other risk factors that we can keep throwing, like, as I said, a lack of activity, for instance, lack of increased sedentary, for instance, if somebody is lacking any exercise. So that's another risk factor. So, again, very, very important. Age and sex, as we consider as non-modifiable, could become modifiable if you throw in these risk factors. So it's very, very important that we understand that so-called myth of non-modifiable risk factors should be removed, and it has no bearing at all. In my armamentarium, when I evaluate the cardiovascular risk in my patients. Now, hereditary, that's another risk factor which is non-modifiable, so-called, but again, it has no bearing once you throw in all these modifiable risk factors, as I said. So these are CV risk factors, and they could be very, very unhealthy, for instance, in a setting where there are hereditary risk factors like hypertension, for instance, or patient has a risk for premature coronary artery disease. Now, we know what is premature coronary artery disease is, where chiefly it's because of the significantly high cholesterol, if you will. And those patients have familial hypercholesterolemia, or they have familial hyperlipidemia. And these patients have very, very high LDLs, and we'll discuss that at a later time. But LDL is the lousy, I call it the lousy or unhealthy cholesterol, and HDL, of course, they are lacking, and HDL is the healthy cholesterol, so it should be the opposite. That means you need more of healthy cholesterol and less of lousy cholesterol, if you will. And but the familial hyperlipidemia, they have these risk factors. a proneness for diabetes. If your mother and father both have diabetes, the chances are your risk is definitely higher. Or even if one parent has diabetes, or a distant uncle or aunt has had diabetes, the chances are you will also have a higher risk than above the average in the population. So we are looking at several risk factors, including hypertension, cholesterol, diabetes, obesity. Now, if there is a tendency to be overweight in any of your parents, the chances are you will also develop that. Smoking, I would say, sometimes will also impact if your parent is smoking, or both parents are smoking, and you're growing as a child. So again, if you have been exposed to a secondhand smoking, which is now becoming increasingly recognized, as you know, and we are very, very cautious that smokers spend their time outside of the house, outside of the offices, so this way they're not proning the others with the same risk. And of course, at the same time, we encourage that they should quit smoking for their own benefits anyway. But secondhand smoking is now being recognized as a big risk factor, and that should be. In fact, cancers have been reported, coronary artery disease has been reported, linked to secondhand smoking, when actually you're not smoking, but you're just being prone for the smoker's smoke, if you will. And so that's called secondhand smoking. So in a nutshell, cardiovascular non-modifiable risk factors, as I said, again, between the age, the sex, and the heredity, these are the three major non-modifiable so-called risk factors. But that's just a myth. And as I said, you throw in the rest of the modifiable risk factors, all of the bets are off, because then you have proning yourself to more accelerated hypertension, more earlier diabetes, for instance, more earlier weight gain. And of course, smoking will just compound the effects, because smoking is one of the biggest risk factors, both for pretty much all atherosclerosis throughout the cardiovascular tree, starting from cerebral vascular disease, leading to stroke, hypertension, coronary artery disease, where angina and myocardial infarction, sudden deaths have been reported. But remember, premature coronary artery disease is defined where a parent or somebody within the family, immediate family, has died less than 50 years of age, and invariably it's because of the familial hypercholesterolemia, where the LDLs were extremely high, they were not detected. Sometimes even the cholesterol may not be impacted, but if that premature coronary artery disease history is present, it's a family history which is present, then that is a big trouble, and therefore all of these modifiable risk factors should be avoided, and that's the goal. So cardiovascular risk factors in general we have discussed in this video, primarily to ascertain that prevention is still the way to go, and keeping your habits clean, and of course modifying it very, very early on. Like somebody who has premature coronary artery disease in the family, for instance, they could be advised that, look, do not resort to smoking, keep your habits clean as far as food is concerned, exercise daily, be sedentary, and of course watch out for your sugars and your cholesterol periodically. Go to your doctors and have your bloods and check for cholesterol and for your sugars. So this way, if, early onset of any of those things could be immediately treated or prevented. Okay, great. So let's talk again on my next video. This was a very short video. I just wanted to discuss the cardiovascular risk factors. Hope you enjoyed, and stay with us on MuniMeterHealth for newer things that are happening now. Thanks so long.